Hi, this is Austin Nakatsuka at the University of Texas Medical Branch Ophthalmology Residency Program presenting a case of cataract surgery for lens particle glaucoma. Our case involves a patient who recently had a pars plana vitrectomy for rhegmatogenous retinal detachment that started with an operculated retinal hole as indicated here. During the procedure, the retina fellow noted that his light pipe happened to touch the posterior capsule of the lens. The patient then presented to the emergency department approximately 3 weeks later with a red, painful eye. Intraocular pressure was measured to be in the 40s, and on slit lamp examination, lens cortical material was noted to be in the anterior chamber. It was at this point that urgent cataract surgery was scheduled for a diagnosis of lens particle glaucoma. Trypan blue was used to stain the capsule and a continuous capsulorhexis was made. At this point, the cataract was noted to be composed mainly of soft cortical material, and this was able to be removed with the INA. As the cataract was removed, a large tear in the posterior capsule was found. Triescence was then used to look for any anterior vitreous material. However, this patient had had a previous pars plana vitrectomy and no vitreous was noted to be found in the anterior chamber. At this point, white cortical lens material was noted in the vitreous cavity. The INA was then directed through the posterior capsule tear into the vitreous cavity and the white cortical material was removed. We can also see a large nuclear fragment was also in the vitreous cavity, but this was not able to be removed by the INA. In general, it is usually unwise to aspirate in the vitreous cavity as you can never tell if there is any remaining vitreous. However, this patient did not have any consequences from this as he had already had a complete vitrectomy from prior. However, in retrospect, this should probably have been avoided. When the cortical material had been completely removed, a 3-piece lens was then placed in the sulcus and optic capture was achieved. The incisions were sutured shut and were noted to be watertight. The patient was then seen the following day and his pressure had returned to normal. He later underwent a retina procedure to remove the nuclear fragment in the vitreous cavity. And this is our case of emergent cataract surgery for acute lens particle glaucoma.